Hello, my name is Kaylin, and this is my head-to-toe assessment for Dr. Powell's Spring 2025 acute class. I'm going to go ahead and scan the room. Trying to get the floor in there too. And then I'm going to try to scan the ceiling. Okie dokie.
And you still here?
Yes.
Okay.
Are we good?
Yeah, you're good.
All right, thanks. All right, let's do this thing. So, I have washed my hands and introduced myself to the patient and confirmed patient identity with 2 identifiers. I am going to start by looking at the skin of the head, face, neck, anterior, posterior chest, upper and lower extremities, and the abdomen. I'm checking for color, temperature, texture, turgor, edema, moisture, bruising, lesions, scars, and nevi. I'm also looking at the head to check for the size and symmetry. It is normocephalic in a midline position. I'm going to palpate the scalp. I'm checking for masses, indentations, tenderness, or infestations. I'm looking at the hair. The color is brown and the texture is coarse. I'm now moving on to the face, palpating the temporal arteries for tenderness. I'm going to also palpate the frontal and maxillary sinuses for tenderness. There is none. I am going to go ahead and assess the lymph nodes. So in front of the ear, I got the preauricular, behind the ear, postauricular, behind the scalp, occipital, and then I'm checking underneath the jaw for tonsillar, submandibular, and at the very tip, submental, anterior cervical, posterior cervical, and supraclavicular. There is no tenderness or no nodules noted. I am going to palpate over the masseters for TMJ, so open, close, and clench. So there was no subluxation or crepitus noted. I also had the patient clench. That was me assessing for the cranial nerve number 5, which is trigeminal. I'm also going to assess for trigeminal by having the patient close their eyes. Tell me where I'm touching.
Forehead, cheeks, nose, chin.
Good job, you can open your eyes. I'm now going to assess for cranial nerve number 7, which is facial, by checking the symmetry with the following movements. So smile, frown, pucker your lips, puff out your cheeks, and raise your eyebrows. Good. And now I am going to move on to the ears. I'm inspecting and palpating the tragus and pinna for masses or tenderness, which there is none. And I'm going to go ahead and look inside his ears. So the auditory canal is patent, and the tympanic membrane is perlicerated bilaterally. I'm now going to assess cranial nerve number 8, which is vestibulocochlear, by doing a series of 3 different tests. First is the whisper test, so I'm going to have you block off one ear and repeat after me.
99.
And the other.
99.
Good. Now for the Weber's test, I want you to tell me if you hear this in the left, middle, or right.
Middle.
Good. And now for Renee's test, tell me now when you stop hearing the vibration, okay?
Now.
Okay, other side.
Now.
All right, so he could hear the vibrations longer outside of the ear, which tells us that air conduction is greater than bone conduction. I'm now going to move on to the eyes. I'm going to be looking at the eyelashes, eyebrows, and palpebral fissures. I'm going to pull down the lids to look at the conjunctiva and sclera. I'm checking for discoloration, lesions, or discharge. I'm now going to assess cranial nerve number 2, which is the optic nerve, by having the patient look at the Snellen eye chart and close one eye and read the lowest line you can.
P-E-Z-O-L-C-F-T-D.
And the other eye?
P-E-Z
In both eyes?
PEZOLCFTD.
Okay, good job. And I'm also going to assess the peripheral vision. So tell me when, look at my nose and tell me when you see my hands.
Now,
And how many fingers am I holding up? And again?
now,
And how many fingers?
2.
Good. I'm now going to assess the oculomotor nerve by testing the pupillary response to light. So just look at my nose. Good. Alright, pupils are pearl. And now I'm going to assess, that was for oculomotor nerve, cranial nerve number 3. I'm not sure if I said that. Now I'm going to assess cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens by having the patient testing their conjugate gaze. So look at, follow my finger with just your eyes. Good job. And I'm also going to test for accommodation and convergence. So look at my finger and follow it in. Good job. And so now I can move on to the nose. The nose is straight, and I'm not going to move on to the nose yet. I'm going to look at his eyes, and I'm going to check for red reflex and the internal structures of the eye. So, beautiful. And, oh wow, okay, good. Now I would like to move on to the nose. The nose is midline and straight. I am going to have the patient close their eyes and blow off one nostril and sniff, and the other one, sorry. Okay, so open your eyes and tell me what you smelled.
Alcohol.
So that tells me that his cranial nerve number 1 is intact, which is your olfactory nerve, and his nasal passageway is patent. And now moving on to the mouth, I'm going to assess the lips, teeth, gums, buccal mucosa, palate, tongue, under the tongue, posterior pharynx, and salivary ducts and tonsils. So I get my light and say ah. Alrighty. So I know that cranial nerves 9 and 10 are intact, which is the glossopharyngeal and the vagus, because the uvula and palate would rise and fall with phonation. There's something else. Oh, tonsils. He does not have any present, but I would grade them if he had them. So now I'm going to have him stick out his tongue, and now go up, down, left, and right. So his tongue is midline and without fasciculations, which tells me cranial nerve number 12 is intact, which is your hypoglossal nerve. Now I'm going to check the trachea, which is midline, and I'm going to palpate the thyroid. And I'm going to push to one side, swallow, push to one side, swallow. The thyroid's not enlarged and there are no nodules. I'm now going to palpate the carotid, which is +2, +2, and I'm going to auscultate with my bill for bruits. Great. Now I'm going to have the patient turn around and face the other direction. When the patient turns around, I'm looking at the posterior chest. I'm checking for any signs of respiratory distress, and that includes use of accessory muscles, retraction, cyanosis, tachypnea, nasal flaring, and tripoding. I'm also checking for obvious deformities and symmetry, so I'm going to have you take a deep breath and out. So his chest rises and falls symmetrically. And I'm going to assess for tactile firmness. So say 99 when you feel my hands.
99.
Alrighty. And now I'm going to percuss. Okay. Resonance was heard throughout. I am now going to listen with my diaphragm to the lung sound. So just breathe regularly for me. All right, and now I'm gonna assess for egophony, so say the letter E when you feel me touch. And now for bronchophony. No, say 99 when you feel me, I'm sorry.
99, 99, 99, 99, 99, 99.
Okay, and now for whisper pectriloquy, whisper 99. Alright, and while I'm back here, I'm gonna assess for CVA tenderness. So tell me, does that hurt?
No.
And here? Alright, you can flip the other direction. Just like with the posterior chest, same thing with the anterior chest. I'm going to be checking for signs of obvious deformity and symmetry. So take a deep breath in and out. The chest rises and falls symmetrically. I'm also going to listen with my diaphragm to the lung sounds of the anterior chest.
Excuse me.
Just sneeze right on me. So now I am going to assess tactile firmitus. So to say 99.
99, 99, 99.
Good. And now I'm going to listen with my diaphragm the heart sounds. So I'm listening to the aorta, which is on the right sternal border, second intercostal space. Pulmonic, which is on the left sternal border, second intercostal space. Herb's point, left sternal border, third intercostal space. Tricuspid, left sternal border, fourth intercostal space, and mitral, which is left midclavicular line, fifth intercostal space. And now I am going to have you lay at a 30 to 45 degree angle. And I'm going to be assessing for JVD while the patient is in this position. I'm also going to be inspecting and palpating for heaves, lifts, and thrills. All right, good. And now I'm going to lay the patient flat. I'm going to listen with my diaphragm again. So aorta, pulmonic, herbs, tricuspid, mitral. I'm going to do the same thing with my bell. All right, good. I'm going to palpate the PMI. Ooh, no, sit back up for me real quick. I'm so sorry. I have such a good patient. Now I'm going to palpate the PMI. All right, very good. And I'm going to listen with my diaphragm for 60 seconds. Wow, 1 whole minute. So the rate is 60 and the rhythm is regular. S1 and S2 were noted. Now, if you could lay flat again for me, so sorry. So I listened to the heart sounds with my diaphragm and my bell. Now I'm going to I'm going to look at the abdomen for symmetry and contour. The abdomen is flat, there's no masses noted, and it's symmetrical. I'm going to auscultate the arteries with my bell. So I got the aorta, renal, iliac, kind of near the belly button, iliac, and a little further down towards the groin, femoral. All right, and now for the abdomen, I am going to keep my stethoscope on and auscultate with my bell, starting in the right lower quadrant and moving clockwise. Okay, and I listened for 5 whole minutes and his bowel sounds are normoactive. I'm now going to percuss. And percussion, timpani was heard in dullness over organs. And now I'm going to palpate with light sensation and deep sensation. And then I'm going to palpate the spleen and the liver. Okay, good job. And now I'm going to have you sit up for me. So, I am going to be inspecting and palpating the hands, wrists, elbows, and shoulders. I am looking for redness, swelling, deformity, edema, nodules, tenderness, crevitus, and symmetry. I'm gonna have you hold your hands out for me. I'm gonna look at the cap refill, less than 3, less than 3. I'm gonna feel for the pulse, radial pulses, which is +2. And now I'm going to assess the range of motion of your fingers, so follow my motions: flexion, extension, hyperextension, abduction, adduction, thumb opposition. Good. Now with the wrist, follow my movements: flexion, extension, hyperextension, rotation, ulnar deviation, radial deviation. Good job. Now with the elbows, we're going to do flexion, extension, hyperextension. Good. With the shoulders, we're going to do flexion, extension, hyperextension. We'll do internal rotation, external rotation, adduction, abduction, circumduction. Good job. While I'm up here, I'm going to go ahead and assess the strength of his hands with grips as hard as you can. 5 out of 5. Now I want you to make a muscle pull against me, push against me. Assessing the strength of the elbows is 5 out of 5. Now I want you to make a T. Try to push down against me. Okay, push up against me. 5 out of 5. I'm also going to assess the strength of the shoulder by having the patient shrug against resistance. 5 out of 5. And that's also assessing for the spinal accessory nerve, which is cranial nerve number 11. I am now going to assess for stereogenesis by having the patient close their eyes, and I'm going to place an object in your hand. All right, what is that?
Key.
All right, good job. And other hand.
Pen.
All right. And now for granthesthesia, hold out your hands. I'm going to write a letter or a number. Tell me what it is.
A.
All right.
8.
Good job. I'm now going to do cerebellar coordination, rapid alternating movements. So follow my movements. It's thumb opposition, or serial finger opposition. And then we'll do hand flip-flop. And then finger to nose. So touch your nose, touch my finger, touch your nose, touch my finger, other hand. Finger, nose, finger, nose. Good job. Now I'm going to, as I'm doing this, I'm going to be assessing the overall skin integrity, warmth, and color, and I'm also going to be checking for edema. I'm going to check for deep tendon reflexes real quick. So if you could hold up, just relax your wrist for me. I'm checking the brachioradialis, so, okay. Bicep and tricep. Okay, other side. Brachioradialis, bicep, and tricep, just relax. All right, and patellar, so just relax your legs. Good job. Okay, and then Achilles. And then, here, let me hold it for you. There you go, and Babinski. Can you see me? Just a little swipe of the foot. Okay, good job. So now I'm going to assess I'm going to do a cap refill test on the toes, which is less than 3, less than 3, and I'm going to check the posterior tibial pulses, +2, and dorsalis pedis, +2. Now, with your feet, I'm going to have your toes follow my hand movements. So we're going to do flexion, extension, hyperextension, abduction, adduction. With your ankles, I'm going to do plantar flexion, dorsiflexion, rotation. We'll do inversion, eversion, And yeah, I got a little thrown off, sorry. I'm gonna have you push against my hands now like you're driving a car, so push, and now pull. So strength is 5 out of 5. I'm now going to test his knee strength by having you lift up against my hands. 5 out of 5, pull down. All right, 5 out of 5, good job. And now your hip strength, push inward against my hands, 5 out of 5, and outwards. Okay, hip strength, 5 out of 5. Now I'm going to have you stand up. And we're gonna assess the range of motion of your, please scoot over, of your knees. So we're gonna do flexion, extension, hyperextension, flexion, extension, hyperextension. Then we're gonna do hips. We'll do flexion, extension, hyperextension, flexion, extension, hyperextension. We'll do, good job. We'll do adduction, abduction, circumduction. We'll do internal rotation, external rotation. And then same thing, adduction, abduction, circumduction, internal rotation, external rotation. That's great. Now, what should I do with you? I guess I could do your spine. So turn around for me. So when looking at the spine, I'm making sure that he has good alignment. I'm palpating and inspecting for tenderness and expected curvatures. When the patient flexes their cervical spine, you can look at their shoulder blades to assess for scoliosis and make sure that they're equal. And you turn back around. Now we're gonna assess the lumbar spine range of motion with flexion, extension, hyperextension, lateral flexion, rotation. And then cervical spine, same thing. Flexion, extension, hyperextension, lateral flexion, rotation. I'm now gonna have you close your eyes and hold out your arms like a T for a Romberg test. So make sure there's no swaying noted. Okay, you can open your eyes. Now you're gonna take a couple steps towards the camera and then walk back to me heel toe to assess your gait. Good. So now I'm gonna have you hop on one foot and then hop on the other foot. Good job. And I'm trying to think if there's anything else that I'm missing. Oh, I know something. Okay, so I'm gonna have you sit down. Roll up your sleeves for me. With my cotton ball, I'm gonna assess for light sensation. So tell me where I'm touching you.
Right arm, left arm,
All right.
right ankle,
Just pretend like you don't. Pretend like you have shorts on.
left ankle,
Okay. And now I'm gonna check for vibratory sensation. So tell me, wrist or ankle. I'm gonna do it over his wrist.
right wrist, left wrist,
And over the medial malleolus.
right ankle,
Okay.
left ankle.
All right, good job. And I think that's it. So thank you so much for watching. Please enjoy.